Hi, I'm Dr. Salo Stanley, and this is a little tuning fork healing sound session. And these are my forks that I've had made in Germany. They're plated with titanium, and they're done in the frequency of C sharp. So, first of all, a lot of times patients always ask me, or people that want to learn how to use this technique, ask me, how do I use these forks? And basically what I say is, first of all, to set up your healing area. And what I mean by that is I use a little stool here with either some carpet or padding, or if you like, to make this a little easier, I just fold up a towel here so I have an area to tap the tuning forks on. What that does is it keeps it from acting a little bit too loud. If I tap them there, it sounds a little bit discordant to me, whereas this helps muffle the sound, but yet you're still getting a nice bounce. So basically, when you do hold the forks, when I was taught in Sedona, Arizona, I was taught that we could hold the forks this way with our fingers with the fat part of the tuning fork, or we can hold them at the stems. Either way, whatever you feel comfortable doing is fine. But basically, the reason I like holding them at the stems is because I like using this as a fulcrum when I am bouncing the forks, almost like when, drummers drum on a snare drum. So basically, if you take the forks by the stem and just pick them up this way and use this as a pivot point and just let this drop down and hit like that, you're going to get a nice tone going. A lot of mistakes students make is they grab onto the tuning fork and they hit it this way, and you won't get a nice sound, and it muffles everything that's coming out of the fork. So basically, by the stem or this area here, whatever feels comfortable for you, let that drop back, kind of cock it like a gun, and let that drop that way, and you're set to go. Basically, when I start a healing, of course, whatever method works for you as far as invoking protection or bringing in any of the people that you usually work with, or prayer, anything that you can think of that works for you, go ahead and do that. I just like to invoke a lot of the ascended masters, archangels, and I think of a bubbled white light around my patient, and I always say for bringing in the highest good and the highest light. So whatever works for you, go ahead and do that. So for starting, I tap the forks, and I always let the patient hear the tone first. So I put them around the ears about this far away for a few seconds. And then I tap them again, and I put them next to the ear. This allows the patient to feel comfortable hearing what the tone is, and for the brain to start to resonate to whatever this frequency is, which is C sharp. So basically, I'm just going to come around to the patient here, which Denise has volunteered to do for us today. And I just tap the forks here, and I'm just going to move around to this side of the bench and bring this next to her ears for a few seconds. And then if you like, you can draw the energy down a little bit. When you do that, the vibration goes over the total energy system of the body, the whole chakra system. And then I tap gently again, and I bring this up next to the ears. And you can do this 2 or 3 times, whatever feels comfortable for you. And then bring the energy down here. Now, the important point to start, if I had to say one thing today on demonstrating how to do the sound healing, is at the bottom of the feet here, and we can't see this on camera, but if you take your foot and you have the patient kind of scrunch their toes together, the little crease or indentation here where it meets the toes, and it's about right here on the bottom of the foot, it's called the kidney 1 point. And that is the basic energy of the body, okay? That's your battery. So anytime we do healing, no matter if you forget about doing everything today, you always need to start a session at the bottom of those points and also end the session there. This helps open up the channels at the beginning of the therapy And at the end, it closes down and grounds the patient before they leave. You don't want them kind of leaving a little la-la and a little bit too discordant. So basically, I tap the forks like that, and I bring the stems, I kind of let them lay back like this, and put them right here on the kidney 1 points. And you can correct me on this. Right now I'm thinking I usually don't memorize all the points, but it's either the kidney 1 or the kidney 3 points. Those are the only 2 points you really have to understand and know. So I just let them vibrate and let the patient feel what each side feels like. And I do that for a few seconds or even a minute or so. And you will notice that one side of the foot will begin to absorb the vibration more than the other. And that means that this person has an imbalance in their body, either the left or right side. A lot of Chinese practitioners check pulses on each side of the body to check the polarity, or if there is harmony on one side compared to the other. This is also another way of doing this, but when you be able to tell if the vibration is beginning to get absorbed a lot quicker than the other, then you know that that's the side of the body that is lacking an energy flow. And pretty soon, after a while, you'll notice that both of them will be vibrating equally, and then you know that, oh, there's something happening. So next I go into what we call one of the 4 gates. It's right here at the top of the toes, right in this little indentation here. You can just apply the forks here for a few seconds and vibrate, and just tap the forks and apply here. Then after that, I like to go into the inside of the foot. It's right by the heel of the foot. It's very easy. You don't have to worry about being so precise right now when you're learning to do this, for the fact that it's vibration. It's going to vibrate during the bottom of the whole heel of the foot. So it's not like Chinese acupuncture where the point has to be so precise because you're using a needle. So I do that. This is a great point for women that have menopausal problems. It's great for also calming if you're very nervous or upset. And then I like to get on either side of the ankle. That creates a great bone resonance and vibration and healing. And I'll go to the alternate on either side of the ankles. Then next, all you have to remember is there's no right or wrong of doing this. If you apply the forks to any type of bony prominence, like on the shin bone here or the long bones of the leg, you can't go wrong. This is going to vibrate the whole leg and a lot of the chakra systems. So this is a great balancing. So you can just do the long bones here like this. Or if you feel more comfortable, sometimes I like to apply them equally on each leg this way and work just points this way up. Or you can just work points this way to this way, whatever feels comfortable for you. Then you can also, if you like to work with people that have low back problems, if you work any of these points here on the side of the leg, all the way up to the hips here, this is good for sciatica. This helps a lot of patients that have low back problems with pain running down the legs. Can't go wrong going on the side of the legs here for that. And I have a lot of success with this, with patients' pain going away, just working those points. So after we're done with the legs, I like to go, since the hands are right here, it's really easy, you have easy access. This is the other part of the 4 gates here. It's right in this indentation of the thumb, and right where you hit the bone. You can just put 2 forks there, or you can alternate. If your patient isn't too big, you can lean over if you like. But for me, so I don't hurt my back, is I usually just work a point like this at a time, and then I'll go around to the other side of the table to get them balanced. This is a really important point for a lot of patients that have headaches, sinus problems, neck problems, jaw, teeth, even neck pain. This will help alleviate a lot of that, a lot of pain that they're having. I would not do these points on pregnant women. In fact, anyone that is doing sound therapy, I wouldn't do any sound therapy unless they took a specific class on that, because there's certain acupuncture points that you do not want to be performing on any pregnant women. So I just wanted to let you know about that. So after I balance, and I would have probably went over to the other side to do the same thing that I'm doing here. In fact, I'll just rotate over there so the camera would have a little better view of me. after I work these points on the hand, then I just work just like the leg. I work the long bones all the way up the arm. I just tap. And another tip is, a lot of times when I was taught in Sedona, you can tap it and you can just let the vibration just stay there for a while until all of it stops, and then you can go ahead and tap again if you like. But for me, I found after doing this work for the last 5 years that if I tap them a little bit more quickly, it's almost like building up energy along that energy meridian. So it's like you're feeding in energy a little bit more and a little bit more and a little bit more until it becomes full. And it seems to, I think it has a little bit better success instead of letting it run out. But whatever feels comfortable for you, there's no right or wrong, again, on doing this work. So after we do the arms, I love doing these 2 points here. It is right below the breast area and on the chest. It's right below that on women. And these 2 points here are 2 points that Shirley MacLaine had in her spiritual awakening. And in Chinese medicine, these are spiritual points, or what we call the Christ consciousness points. This really helps people on their spiritual journey if you work those points there. Then after that, I like to go to the heart and mind. This helps balance out the heart and mind. You just put it anywhere you want on the forehead here, or the third eye, and on their chest area here. Patients really feel this one, and they really like this one. It's very relaxing. So you can do that for a few minutes, and after I do that, then I go balance the forehead and the crown chakra area here. It creates an L effect, as you can see. And what that does is that actually resonates the skull. It helps balance out the left and right hemisphere of the body. And it also stimulates the pineal gland, which is your psychic center. A lot of scientists don't realize what the pineal gland does, but now with new research that is happening, they realize it's an important point for releasing serotonin, which is a deep relaxation in our body. Helps release, and it also stimulates a lot of our psychic centers in our body. So I think that's going to be up-and-coming new research. Then I like to go to the temples here to balance out the right and left hemisphere of the body. So you can just put them a little bit above the ear, and that balances that out. And after that, you can end it if you want by putting them anywhere on the back of the skull here or on the sides or whatever you feel comfortable with. But any one of those work. But I always usually like to end with the tuning forks here or on the crown chakra. That just feeds in this central energy system of the body that balances out the polarities on either the right or left side. And then before I end, I place them again on either side of the ear for the patient to hear. And I draw the energy down. And I do that 2 or 3 times, whatever feels comfortable for you. And I draw the energy down even more to the bottom of their feet, and I have to remember to always close the session with the grounding, and I think of thoughts of them being wrapped in sheets of rainbow light, which is spiritually appropriate for their evolutionary state for them, or whatever way that you like to invoke your closing sessions is fine. And I just want to make sure, and then as you'll notice, after a healing session, even though this was done very quickly, it's only done in a few minutes, I can even feel on Denise here that each side now is balanced. We have wonderful buzzing vibration equally on both sides of the feet, which is a good sign that the energy channels began to open and that your session was successful. Not that there is any success in life, it's all good, it's all in divine order. And after I feel that that feels appropriate, I close the session with what I call tin shas. And these are Tibetan bells that are made with 7 special metals in Tibet. The Tibetan monks make these, and so each tone is beautiful in its own sense. So you just have to figure out what Tibetan bell you want. You can get them off the internet, but I always suggest going into a store and checking them out for yourself. And my Tibetan bells are over here, and I always like to end the session because this reminds the patient to come back from the session. I tap them here at the bottom of the feet. And I like to bring the energy around the body. Now some healing sessions, they say go counterclockwise, some go clockwise. Whatever feels good for you or whatever your teachings are, that's fine. And some people like to hold them this way too and like to tap them. It makes a little bit different resonance. But for me, I like grabbing the ends here, bringing them up, and tapping them because I then direct the tone or energy over specific areas of the body directly. And then that's the end. I let the patient lay there for a few minutes to let all the energy seep in. And after a session, I always remind them to make sure that they drink plenty of water. And sometimes spiritually, some issues may come up, such as